Dr. Linda Mobula, thank you so much for joining us.
Thank you for having me.
Can you give us a sense of what is happening now? New York was a hotspot in the United States, although cases are going down.
New York City remains the epicenter of the COVID-19 outbreak in the United States. It has more than 300,000 cases. And in fact, it has more cases than any other country in the world right now. And we have seen a steady decline in the number of admissions that we're getting, as well as in the number of cases. And the New York City healthcare system was quite overwhelmed with this pandemic. There was limited bed capacity. Physicians, nurses, healthcare providers were quite overwhelmed with the number of cases that were being admitted. And things are getting better, which is the good news, but I think there still needs to be a lot of vigilance regarding a potential spike or second wave. I think it's important to maintain social distancing measures, but also just to be sure that people stay at home so that we don't see another increase in the number of cases.
What is your take on the impact that this is having on your colleagues, on you, and how do you personally handle this?
It's exhausting, I think, to work on this response. Wearing PPE for several hours takes a toll. My colleagues and I have worked 100 hours a week for the past several weeks, and fatigue is something that comes up. Fear, I think, as well. I think we have to acknowledge that, the fear of becoming infected. But also, I think it does have an effect on one's mental health, as indicated by the suicide of our dear colleague that just took her life. And I think it's important to encourage healthcare providers. Every day in New York City at 7 p.m., everybody claps for healthcare providers. There's been overwhelming support for healthcare providers, and I think we need to continue doing that, not just now, but once the outbreak is over, once the pandemic is over, to continue to provide that support, because we all need it. There are healthcare providers that are separated from their families and that have been separated for a long time. And usually when you're going through a crisis, your family's around to support you. And when you don't have that, I think that does take a toll. The isolation, the long hours, the number of deaths, the number of cases that we're seeing have all affected healthcare providers. So I encourage everyone to continue to provide support to all healthcare workers, because they are in fact heroes.
This is a word that we see now that is being used to call healthcare workers heroes. And you mentioned how people are clapping at 7 p.m. to encourage you. Beyond this, beyond the clapping, the cheering, the heroes calling, what else can make your work easier at this point?
Ensuring that there is that support that is provided to healthcare providers in terms of personal protective equipment, just equipment, but also making sure that staffing is adequate for all these healthcare providers who are working on long hours.
Today we're seeing that although the outbreak is on the continent, Africa remains the region with less case compared to the rest of the world. What do you make of this?
Just because Africa doesn't have as many cases as Europe or the United States does not mean that in the future it won't. And I think there's definitely a risk that Africa could become the next epicenter. And we're seeing an exponential rise in the number of COVID-19 cases in Africa, with South Africa having the highest number of cases. So I think we need to, again, be very cautious about the prevalence of COVID-19. There could be, it could be that we're not testing enough people. So we need to increase the number of tests that we're doing. We need to be able to detect cases much, much better than we are right now. I think mitigation measures are really important. Social distancing, I think, in Africa, and lockdown, I think, are two concepts that will look different in Africa. You cannot ask people to stay at home for weeks and weeks without providing with food. So food security is going to be something that we need to look at differently in low and middle income countries, specifically on the African continent. And there have been multiple people that I've written that have been thinking about how to adapt strategies in Africa because these same strategies, the same interventions that might work in one country might not necessarily work in Africa. So providing that additional support, and I focus on food security a lot because I think it's going to be extremely important to provide support, that type of support to families if you're asking them to stay at home.